Hello everyone, my name is Abhirami and my partner name is Ellen Tan. Today we will be presenting to you on the indications and contraindications of warfarin. So first of all, why is my patient on warfarin therapy? Warfarin therapy is indicated for the treatment and prevention of venous thromboembolism, which is mainly the deep vein thrombosis and pulmonary embolism. Secondly, is for the prevention of stroke in patients with atrial fibrillation of flutter, tissue heart valves, or valvular heart diseases. Third one is the prosthetic heart valves, and the last is acute myocardial infarction. Offering therapy in prophylaxis and treatment of the deep vein thrombosis and pulmonary embolism aims to limit the clot extension and to prevent the thrombus recurrence. In VTE episodes, the length of anticoagulant therapy is determined based on the risk of venous thromboembolism and the risk of hemorrhage. This table obtained from ACCP guidelines showing duration of anticoagulant following VTE clinical condition. It was also noted that warfarin may be used in prevention of venous thromboembolism for total knee or hip arthroplasty and hip fracture surgery with a minimum treatment duration of 10 to 14 days and recommended to extend up to 35 days in outpatient. The latest atrial fibrillation guidelines recommended warfarin therapy for patients with a CHEST-2 score of more than 1, with target INR of 2 to 3 for long-term risk management. Based on evidence, warfarin therapy in AF patients, there was 60 to 70% relative risk reduction in developing ischemic stroke. According to the AHA or ASA guideline, warfarin is indicated for chronic anticoagulant treatment for patients with valvular atrial fibrillation with high risk of stroke and acceptably low risk for hemorrhage. According to atrial flutter guideline, warfarin is recommended as an oral anticoagulant for patients with history of stroke, transient ischemic attack, or a CHEST-2 score of at least 2. It is recommended for 3 weeks prior to and 4 weeks after cardioversion in patients with atrial flutter over 48 hours or unknown period, regardless of CHEST-2 score. Warfarin is used as a prophylaxis and treatment of thromboembolic complication associated with cardiac valve replacement. Warfarin is recommended in combination with low dose of aspirin for patients with aortic mechanical prosthetic valve with or without risk factors or any mitral mechanical prosthetic valve for primary prevention of stroke. Warfarin therapy can be used as an adjunct treatment to reduce the risk of death, preventing recurrent MI and thromboembolic events in post-MI patients. Warfarin used reasonable in patients with STEMI and asymptomatic left ventricular mural thrombi. It may be considered in STEMI patients with anterior apical akinesis and dyskinesis.
So contraindications for warfarin. When can we not give warfarin? So warfarin is contraindicated for patients who are hypersensitive to it, which includes patients who have experienced skin necrosis, anaphylaxis, as well as purple syndrome, all which can cause significant mortality. So warfarin is also contraindicated for patients who have bleeding tendencies such as active GI ulcers, bleeding in the GI, respiratory, or genital urinary tract, cerebral aneurysm, CNS hemorrhage, dissecting aortic aneurysm, spinal puncture, and other diagnostic or therapeutic procedures that can cause significant bleeding, as well as recent or potential surgeries of the eye and CNS. In addition, warfarin is also contraindicated in major regional lumbar block anesthesia or traumatic surgery resulting in large open areas, blood dyscrasia or blood disorders, malignant hypertension, and pericarditis or pericardial effusion. Finally, warfarin is also contraindicated for patients with bacterial endocarditis, unsupervised patients who have high risk of non-compliance eclampsia and preeclampsia, threatened abortion, and pregnancy, as warfarin is teratogenic, pregnancy category X, as well as can cause fetal warfarin syndrome.
And all these are our references.
That's all for us for warfarin indications and contraindications. Thank you.